everyone, this is Dr.Habiburrehman. Today we are going to talk about a new topic, gastroesophageal reflux disease. In this video lecture, we will talk about the definition of gastroesophageal reflux disease, the pathophysiology of gastroesophageal reflux disease, and we will talk about the risk factors, and we will talk about the clinical feature of gastroesophageal reflux disease, and we will talk about the investigations, and at the last we will talk about the management of gastroesophageal reflux disease. So let's first talk about what is gastroesophageal reflux disease. Simply it is called GERD. It stands for gastroesophageal reflux disease. What is gastroesophageal reflux disease? The backflow of gastroduodenal contents into esophagus is simply called gastroesophageal reflux disease, or second definition, you can say that a condition develops when the esophageal mucosa is exposed to gastric contents for prolonged period of time. What is gastroesophageal reflux disease? Simply it is called GERD, and it stands for G stand for gastro, E stand for esophageal, R stand for reflex, and D stand for disease. Gastroesophageal reflux disease. We can simply define it: the backflow of gastroduodenal contents into the esophagus is called gastroesophageal reflux disease, or another definition we can define it that when the esophageal mucosa is exposed to gastric contents for prolonged period of time, resulting in esophagitis. So this is all about the definition. Let's draw a diagram to have a concept. In this diagram, you see this is esophagus and this is stomach and this is part of small intestine, duodenum. In between the esophagus and stomach, at the junction between esophagus and stomach, there is a sphincter which is called lower esophageal sphincter. This one is called lower esophageal sphincter. The function of this sphincter is to prevent the backflow of stomach and duodenal contents into the esophagus. Or let's suppose here food is present. Whenever this food or contents try to go back to the esophagus, so this wall will be closed. The lower esophageal sphincter will be closed and will not allow the contents to go into the esophagus. It will not be allowed to go into the esophagus. The function of lower esophageal function is to prevent the backflow of stomach or duodenal contents into the esophagus. This is normal physiology. But whenever there is abnormality in this lower esophageal sphincter, whenever the pressure is reduced or whenever this sphincter is relaxed, so the contents of stomach and duodenum can easily go back to the esophagus. It can go back to the esophagus, and as the contents contain the acids, it will cause or damage the mucosa of the esophagus. It will cause sign and symptom of gastroesophageal reflux disease like esophagitis, heartburn. We will talk about the clinical feature later on. Just simply remember that the lower esophageal sphincter prevent the backflow of stomach and duodenal contents to flow back to the esophagus. And whenever there is a problem in the lower esophageal sphincter or whenever it relaxes, so the contents of stomach and duodenum can flow back to the esophagus and damage the esophageal mucosa. So in that condition, we call it gastroesophageal reflux disease. So after definition, now we will talk about the pathophysiology. Again, I will draw the same diagram. Esophagus, then sphincter, and in the stomach. Lower esophageal stomach. Some people call it LES, or in some books it is written LOS, lower esophageal. Different spelling. See this diagram. In this diagram, I draw the esophagus, lower esophageal sphincter, and stomach. Normally, in a healthy person, occasionally there is reflux of contents. There is gastroesophageal reflux. In a normal person, there is gastroesophageal reflux, but that is not a pathology. That will not cause a disease. Why? Because whenever there is the backflow, let's suppose this is contents, gastric contents. So when it reflects back to the esophagus, when it reflects back to the esophagus, there is esophageal peristalsis. There will be peristalsis. And this peristalsis will take the contents back to the stomach. Normally there is reflex of contents, there is gastroesophageal reflex, there is backflow of contents, gastric contents into the esophagus, but that will not cause a disease because the esophagus will start peristalsis, and it will clear the esophagus from the contents. So number one, there is esophageal peristalsis, and number two, the saliva which flows into the esophagus, this saliva will neutralize the residual acids, and will not lead to damage the esophageal mucosa. Let's have a review. This is esophagus, this is stomach. In a normal person, there is backflow of gastric contents into the esophagus, but it will not cause a disease because there is esophageal peristalsis, and this peristalsis will push the contents back to the stomach, and it will clear the esophagus. And number two, the saliva which comes down to the esophagus will neutralize the residual acids. So it will not lead to cause any damage to the esophageal mucosa, and there will be no sign and symptom of gastroesophageal reflux disease. But whenever there is prolonged exposure of esophageal mucosa, to acids, whenever there is prolonged exposure of esophageal mucosa into the gastric contents or acid, it will lead to the gastroesophageal reflux disease. We will talk about the risk factor of gastroesophageal reflux disease. What are the factors which causes the backflow of contents, or which causes the sign and symptom of gastroesophageal reflux disease? So there are different factors. There are different factors which causes the sign and symptom of gastroesophageal reflux disease. Dietary factors. The second factor is defective esophageal clearance. Another factor is abnormality in lower esophageal sphincter. Another risk factor is hiatus hernia. Another risk factor is delayed gastric contents, delayed gastric emptying. And another risk factor is increased abdominal pressure. So we are talking about the risk factors. The risk factors include dietary risk factors, esophageal abnormality, clearance of esophageal abnormalities. Another risk factor is problems in the lower esophageal sphincter, problem in the emptying of gastric contents, hiatus hernia, and increased abdominal pressure. All these are factors which lead to the sign and symptom of gastroesophageal reflux disease. I will draw a diagram so that it will be easy to memorize all these things. Again, this is esophagus. Again, at the end of esophagus or at the junction of esophagus and stomach, again there is lower esophageal sphincter. And then I will draw hiatus hernia. Hiatus hernia, and then I will draw the stomach and diaphragm. Esophagus, lower esophageal sphincter, hiatus hernia, diaphragm, stomach. So how to memorize all these risk factors? See this diagram. So first we'll talk about the dietary factors. For example, we'll talk about the dietary factors, which includes the dietary factors like chocolates, tea, coffee, chocolates, alcohol. All these dietary factors, when a patient or when a person take this diet, so this diet will relax the lower esophageal sphincter. And when it relaxes the lower esophageal sphincter, so there will be the back flow of the gastric or duodenal contents into the esophagus. So it will lead to the sign and symptom of gastroesophageal reflux disease. So one of the risk factors we talk about is the dietary factors, which includes tea, coffee, chocolates, alcohol, etc. Another risk factor is defective esophageal clearance. Now we will come down, we will talk about the esophagus. As we talked that normally there is gastroesophageal reflux, but the esophagus, with the help of peristalsis and with the help of saliva which neutralize the acid, it will not or it will prevent the damage to esophageal mucosa. So whenever there is a problem in the defective esophageal clearance, whenever there is problem or whenever there is poor peristalsis, whenever there is poor peristalsis, so the esophagus will not be able to clear the esophagus. So it will lead to prolonged exposure of esophageal mucosa into the gastric contents and will cause the gastroesophageal reflux disease. For example, these are gastric contents and it has a backflow. Normally this esophagus should clear the esophagus with the help of peristalsis, but when there is problem in the peristalsis, so the esophagus will not be able to clear the esophagus properly and there will be prolonged exposure of mucosa into the acidic contents. So it will lead to the gastroesophageal reflux disease. So another risk factor is defective esophageal clearance. Third risk factor is abnormality in the lower esophageal sphincter. As I talked before that the lower esophageal sphincter present at the junction of esophagus and stomach. Normally it prevents the backflow of contents into the esophagus, the backflow of gastric contents into the esophagus. But whenever there is any abnormality in the lower esophageal sphincter, for example, if the pressure decrease or when it relaxes, normally it is contracted. Normally the lower esophageal sphincter is contracted and it prevents the backflow of contents into the esophagus. But whenever there is a problem, whenever there is decreased pressure or whenever it relaxes, so the contents can easily flow back to the esophagus and will cause the gastroesophageal reflux disease. So the risk factor abnormality in the lower esophageal sphincter. Another risk factor is hiatus hernia. What is hiatus hernia? Hiatus hernia, when there is protrusion or when there is herniation of small part of stomach into the chest through the esophageal opening, is called hiatus hernia. So I will draw a diagram so you can easily understand what is hiatus hernia. This red color is a diaphragm and this is normal structure, esophagus, lower esophageal sphincter and stomach. Sometimes or in the hiatus hernia, what happens? Some part of the stomach, like this part of the stomach, this part of the stomach will protrude, will herniate into the, let me draw all the full diagram. So this is abdominal cavity and this is chest or chest cavity. In this diagram, you see the stomach is in the normal position. All the stomach is below the diaphragm. But in this condition, in hiatus hernia, this part of stomach will move from the abdominal cavity to the chest cavity. In this condition is simply called hiatus hernia. The protrusion of small part of stomach into the chest is called hiatus hernia. So one of the risk factor of gastroesophageal reflux disease is hiatus hernia. Because this hiatus hernia will relax the esophagus, it will relax the lower esophageal sphincter. Whenever there is hiatus hernia, it will relax this sphincter. So this is hiatus hernia. This is diaphragm. This is diaphragm, and this is the part of stomach which has protruded from the abdominal cavity, which has protruded to the chest. This part is called hiatus hernia. So it is the risk factor because this hiatus hernia will relax the lower esophageal sphincter, and when it is relaxed, so there will be backflow of contents into the esophagus. So one of the risk factors is hiatus hernia. And the last risk factor is increased abdominal pressure. Whenever there is increased abdominal pressure in the conditions like obesity, pregnancy, it will cause the gastroesophageal reflux disease. In these conditions, in obesity and pregnancy, there will be increase in the abdominal pressure, and this increase in abdominal pressure will cause the relax of lower esophageal. There will be increased abdominal pressure, and as a result, there will be relax of lower esophageal sphincter relax, and as a result, there will be backflow of gastric contents into the stomach, leading to the gastroesophageal reflux disease. Let's have a review. We are talking about the risk factor of gastroesophageal reflux disease. The risk factor, how to memorize, very simple. See the diagram and go step by step. Starting from there, so dietary factor, then second step, defective esophageal clearance, then come down, third one, abnormality in the lower esophageal sphincter, then come down, fourth one, hiatus hernia, and then defective or delayed emptying of stomach contents, and the last one, increased abdominal pressure. So in dietary contents includes tea, coffee, chocolates, alcohol. All these things will relax the lower esophageal sphincter and will lead to the gastroesophageal reflux disease. The second one, defective esophageal clearance. When there is poor peristalsis, the esophagus will not be able to clear the esophagus. Because of the poor peristalsis, it will lead to the gastroesophageal reflux disease. Abnormality in lower esophageal sphincter. Whenever there is reduced pressure or when the sphincter is relaxed, there will be backflow of contents, will lead to a sign and symptom of gastroesophageal reflux disease. Then hiatus hernia, when some part of the stomach is protruded into the chest. This is called hiatus hernia. It will relax the lower esophageal sphincter and will lead to the gastroesophageal reflux disease. Another one is delayed gastric emptying, but for this mechanism is still unknown. The last one is increased abdominal pressure. In certain conditions like obesity and pregnancy, there is increased abdominal pressure, and when there is increased abdominal pressure, the lower esophageal sphincter will relax, will lead to the gastroesophageal reflux disease. Now we will talk about the clinical feature of gastroesophageal reflux disease.